Good afternoon, everyone. This is Krista Scott from Childcare Aware of America. Wanted to thank you so much for your time today. We are going to be talking about Childcare 201 state systems, from statute to state systems. Just wanted to talk about your presenters today. I am the Senior Director for Childcare Health Policy here at Childcare Aware, and I'm joined by Jen Bump, who is the Senior Director for Practice Innovation at Childcare Aware. Our information will be up at the end in case you realize that you want to contact us. But before we get into the substance, I also want to take a moment to orient you to Childcare Aware. I think many of you know who we are here at Childcare Aware of America, but in case you're unfamiliar with our work, we were founded in 1987 as a 501c3 nonprofit membership organization. We were the National Association for Child Care Resource and Referral, and we grew out of state and local child care resource and referral agencies that felt that they would like to have a national membership organization to represent their interests close to Washington, D.C. So we are here in Northern Virginia, in Arlington, Virginia, just across the Potomac from the Capitol. Our role, as we see it, is to provide supports for child care resource and referral agencies and other early childhood stakeholders by providing training, resources, technical support, best practice guidance, policy analysis, advocacy work, partnership opportunities in the areas of child care and early learning. So that's how we see ourselves, and that's what we can provide for you as interested parties in the child care and early learning world. For our topics today and the purpose, we're going to cover several items. The purpose of today's call is to help orient you to the child care landscape from a federal policy into state policy and practice lens. So we're going to talk about the Child Care and Development Block Grant, what it is, what it means, its relationship to the Child Care and Development Fund, and those regulations. We're going to talk a little bit about child care funding today, and then we're going to dig in and talk about the relationship to state child care plans and the influences of those plans and how they connect back to CCDBG. In that, we're going to do an overview of licensure and regulations, license-exempt child care. We're going to talk about the influence of early learning guidelines, the influence of quality rating and improvement systems, and just touch on the early Head Start and child care partnerships. And certainly, and this is the part that I'm really here for, we're going to hear from Jen Bump, who's going to talk about the child care resource and referral network landscape across the U.S. If you aren't aware, the resource and referral landscape is very different from state to state, so she's going to provide a great overview of what that looks like, the different types of child care resource and referral agencies and networks in the country. Just a few notes for housekeeping. I'm going to take some opportunities to do question and answer over time, but I'm going to ask that you put your questions into the chat box, and then I'll stop periodically and read any questions that come up and do my best to answer them. So with that, we'll go ahead and get started. And actually, I want to start with a poll. I want to know who's with us today. Oops. I want to know who's with us today. So if you could tell me a little bit about what field you're in. I'm going to launch this poll. And go ahead and let me know what field are you in. And I apologize, this is not all-inclusive of the variety of folks that are on the call today. Give you guys a couple more seconds here, just to let us know what field are you in, or What area best describes where you are? And I saw someone put their a more specific answer in the chat box. Please do, if you want to provide a little bit more context or detail to your role, please do so. Give me a couple more minutes. Looks like most of you have voted. We're still waiting on a couple. Okay, it looks like most of you have voted. I'm going to go ahead and close the poll. And many of you are in the child care field already, which is fantastic. I hope that you guys can take something away here. And if you have things to contribute, please do so. You know, you guys are also experts in this field too. And so please share what you can to help the rest of us learn and know from your experience. We have some people from the public health field, but predominantly childcare, and then seconded by advocacy or policy folks. 16% is other, which is interesting. I'd love to know in the chat box what other means, so please let us know what field you represent, and 8% education. So vast diversity of folks today. This is probably review for many of you, but I just wanted to talk about the Childcare and Development Block Grant that was reauthorized in November 19th of 2014. It was the first time in 18 years that childcare was reauthorized, and it made expansive changes to protect health and safety of children in childcare. It also promotes continuity of access for subsidy for low-income families, and has information within the body that requires folks to inform parents and the general public about childcare choices, so that they can make a better and more informed choice when they're selecting childcare. The great thing is that with the reauthorization comes an opportunity to improve learning for millions of children every day. But a better question is, how does this federal statute relate to state plans? So how do we connect the dots? So I like this slide because it gives a really nice overview of the connectivity between these three pieces. The Child Care and Development Block Grant is the federal statute that authorizes the CCDF, or the Child Care and Development Fund. The fund itself is administered by the Administration for Children and Families Office of Child Care. And these funds and the program provides child care subsidies and support and administration, and also have requirements for improving child care quality to states. Regulations are promulgated by ACF that dictate the rules that must be complied with in order for states to receive funds. So you have the Act informing the Child Care and Development Fund, which states essentially apply for and receive based on their child care and development plans. So state plans are written by whichever lead agency is the state administrator for the CCDF program. Every state does it differently. And these plans detail to the Administration for Children and Families how the state is going to implement the CCDF program, both subsidy requirements and quality improvement requirements consistent with regulations that CCDF puts out. A little bit about the funding. A Child Care and Development Fund program consists of three sources of funds. there are two pockets of money that the Child Care and Development Block Grant, right? The block grant authorizes both the program and allocates funding. There's $2.8 million in discretionary funding, meaning it's subject to Congress's budget every year. And in 2016, it was $2.8 billion. And there's also an additional $2.917 billion in mandatory funding that was set forth in the block grant. In addition to that, there is a smaller pocket of funding, the Child Care Entitlement to States, or that's that CCES funding, which is authorized actually through the Social Security Act. And last but certainly not least, states have an option to use TANF money to transfer it into the child care program. So that's how Child Care and Development Fund programs are funded from the federal government. States are also required to match partially to match federal funding. President Obama in his last request requested $2.961 billion in discretionary funds in his FY 2017 request to Congress. In that budget, I think I mentioned that quality as well as child care subsidies is one of the aspects that that states have to include in their plans, and the CCDF proposed regulations and the CCDBG block grant set forth a requirement that states set aside funding for quality improvement activities. Some states are already setting aside more than these required amounts, but some states set forth the minimum requirement. And with reauthorization, they shifted from 4% previously up to 7%. So states are required to reserve a certain percentage of their budget in order to support quality activities. For the next 2 years, for fiscal year 16 and 17, states are required to set aside 7% of their total child care budget just for quality initiatives. That gets raised in 2018 and 2019 to 8%. And then finally in 2020 and 21, for fiscal years 20 and 21, it's increased to 9%. That is just the basic set aside for quality activities. In addition to those 7, 8, and 9% respectively, there is also a separate set aside on top of that that states must reserve for infant and toddler spending, and that's 3% for every year. So ostensibly, for fiscal year 16 and 17, total quality set aside for both infant, toddler, and general reserves is 10%, 11%, and then 12% sequentially. I want to step back and make some connections here between the Child Care and Development Fund regulations and state plans. The way I like to think of it is that the CCDF regulations stipulate what states have to include in their state plans, the required provisions, actions set forth by statute. They're the bones of the plan. And the state regulations, policies, initiatives that really state-specific perspective that provide the assurances or content within plans show how the state meets the CCDF stipulated requirements. They're sort of the muscles of the plan that show how the work is going to get done. When we think about opportunities for state specificity or advocacy to improve state child care systems, the different levers in each state are the existing state regulations and policies that govern the plans that come out of the state administrator, the political climate certainly, any existing partnerships and collaborations in the early learning sectors, and past and current advocacy efforts, and certainly funding sources. Funding sources certainly are drivers for advocacy in child care. We're going to talk a little bit about the first, which is child care licensing regulations. Every state, so the CCDF plans have requirements that say you need to have certain regulations or assurances in place. And the way that most states do this are with their child care licensing regulations. Licensing regulations are designed to ensure health and safety of children in child care. And like I mentioned before, they vary from state to state in content. They also vary from state to state in terms of who must have a license in order to care for children, and we're going to talk about that in a moment when we talk about those who are license exempt. But CCDBG and CCDF requirements influence what states typically have regulations on in their licensure regulations. So for example, CCDBG, the Act and the proposed regulations for the CCDF require states to have minimum health and safety standards and pre-service or orientation trainings and ongoing trainings for providers. So you will see typically in state regulations for childcare that they will have health and safety requirements. States are also required through the law to have their own specific requirements on criminal background checks, on-site inspections for providers, including those who are license exempt. And this has shifted since the reauthorization. There are enhanced requirements now around background checks that's part of the new law. CCDBG also requires training for licensing inspectors now. So states will have to have either policies or regulations on their licensing process or their inspection process. It's also going to require that states have regulations, if they don't already, about group size limits and appropriate provider to child ratios. There's a new mandate requiring ongoing training and a progression of professional development to improve the skills of providers. So you can see there are lots of ways in which the law dictates to the states what the states must do, but still there's a lot of autonomy within states to sort of forge their own way and develop their own unique systems of childcare. So even though there are commonalities that are required by the federal Act and the proposed regulations, every state is going to have a different way that its regulations shape the child care systems. One way in which states vary is with providers who are license exempt and the amount of care that is unregulated in a state. License exempt care is child care that can operate legally without a license. Every state's license exemption is different. Common exemptions, though, are religious or faith-based exemptions, providers who care for just their relatives, care of non-relatives, usually under two, it's one or two folks that are provided care by a non-relative. Public recreation programs are typically license exempt. Before or after care programs that are run by schools. Occasional care, open door policy, private or public preschool, pre-kindergarten programs that already have a mechanism of oversight. Those are often license exempt care, and so they do not necessarily have to comply with all of the regulations. However, with the new CCDBG, they are required to have inspections annually for health and safety. There is care that happens outside of the license exempt or licensed care, and it's important to know that there are license exempt care, but then there are also folks who are operating without license. So it's important to understand what the context looks like, who is eligible for license exempt. License exempt is no longer without monitoring given the new CCDBG, but there might be folks out there operating and performing childcare that may not necessarily be governed by the rules, by the licensure regulations, because they are either operating without a license or they are license exempt. So it's important to understand that context. I want to shift now and talk from the regulation standpoint. Those are licensure regulations are typically the most impactful means of governing the child care systems and what child care systems do and do not do. But recently, with Race to the Top and with the popularity of early learning over the past 5-10 years, there have been pushes to have better standards and higher quality in all early care and education systems. And these have really impacted or have the opportunity to impact the child care system as well. The Child Care and Development Block Grant mentions that funds can be used now to develop early learning guidelines, which are used in childcare as well as pre-K, public pre-K and Head Start programs. And they're set as they're developed and are a set of expectations, guidelines, and developmental milestones that really sort of set forth a developmental and education trajectory and developmental milestones for care providers to use when planning their activities and curriculum. They're broken down by age group and they oftentimes have information for application for English language learners, children with developmental disabilities or developmental delay. They also vary from state to state. Every state that has them has developed their own process and their own early learning guidelines. But they typically cover all essential domains of school readiness, and they're universally designed in order to be developmentally, culturally, and linguistically appropriate. All states and territories have developed early learning guidelines for preschool children, and most all have early learning guidelines for infants and toddlers. These are not a curriculum, but it's sort of a way to sort of anchor the curriculum and the education that's happening in early childhood to help build child skills. These are not required to be used in childcare systems, but they certainly influence the type of care that's being given and enhancing the quality. So that is one area for influence in the child care sphere that is really state-specific. Another state-specific influence on child care are state quality rating and improvement systems, QRIS. A comprehensive QRIS is one that makes program quality comparable across the field and creates and aligns program standards with early learning and practitioner standards. These are essentially rating systems that are implemented in each state to help improve quality. Some systems are voluntary, some are required. Typically the reason why it would be voluntary instead of required is related to funding. Having a quality rating system is expensive. Quality early care and education, as you know, is expensive. So that's why there's a differential there. Some programs are statewide and some are regional. Regional examples are Florida, California, and Kansas. The standards or levels are different from system to system. That's important to know about QRIS. Some QRIS systems are integrated into licensing structures. So if you are a licensed provider, you're automatically participating in the quality rating and improvement system. And technical assistance is typically a part of the QRIS system. The goal is to provide not only a rating or an evaluation of your program and its level of quality, but also supports to help you improve. And the extent to which the support or technical assistance is provided varies from each state to state. New York is a really great example of a system that has a very comprehensive technical assistance process. So QRIS systems essentially are rating systems where the team goes in and evaluates programs in different categories. For example, curriculum and learning, safe and healthy indoor-outdoor environments, workforce development, family and community engagement, leadership, administration, and management. The standards or categories have levels or tier, and the more rigor that your program has, the higher the level. It takes a building block approach so that if you are level 1, there's a way for you to figure out how to improve and move up to level 2. If you're level 2, there will be resources and information provided to you to help you determine how you would make improvements to your program to go to level 3. And the idea is really to both figure out where quality exists and share that for parent and consumer education, but also really to help put programs on a path to quality. So that they can make consistent and continuous improvements to their program to raise the level of quality for childcare and early education. So again, these systems are voluntary. They're not childcare led, but they impact childcare systems. So it's important to understand that the quality rating and improvement systems are opportunities for improvement and growth of quality within the childcare system. Another recent development to improve quality is the opportunity for early Head Start and childcare partnerships. These grants are available through the Administration for Children and Families. An effort to support partnerships between childcare providers and early Head Start providers to serve infants and toddlers from low-income families. They support working families by helping Head Starts expand and child care centers expand to provide full day and full year programs. And they use early Head Start standards that can help child care by serving as a model to help build the child care quality within child care systems. So that is a lot from me, and I wanted to take an opportunity before I pass it over to Jen to look through any questions that you may have about the work. I know I kind of just breezed right through it, and there's a lot there to unpack. Okay, hearing none, I'd like to take the opportunity to pass it over to my colleague, Jen Bump. Jen, are you there?
I am. Thank you so much.
Jen.
That was a wonderful presentation. Thanks.
Thanks.
Hello, everybody. Thanks for attending today. I'm really pleased to have interest in learning about the Child Care Resource and Referral nationwide system. Also very happy to see many Child Care Resource and Referral and state network representatives on the call. So I'll put a nod out to my friends in the field. Krista mentioned a little bit about the history of Child Care Aware of America and noted that Child Care Aware of America began as the National Association for Child Care Resource and Referral, a nonprofit organization that was established through Child Care Resource and Referral agencies and their desire to have representation at the national level, to have consistency throughout the nation, and to have a presence in Washington, D.C. The diagram or figure you see on the left represents a hierarchy or a structure of the Child Care Resource and Referral system. While we've changed our name at Child Care Aware of America, we still serve as a leading voice for child care and child care resource and referral. We convene state and local child care resource and referral agencies throughout the country. A little bit about our communication. We typically will initiate with state networks. These are offices oftentimes sitting in the capital city of each state, and those organizations serve to be leaders in their states, to convene a local community-based child care resource and referral agencies, and to also be a point of contact and a voice for the local agencies, both in their states with their government funders, as well as to be a messenger both up and down to communicate between the national office and the local office, although there are many opportunities for communication all around that pathway. Turning attention to the right-hand side of the screen, you'll see another a Venn diagram that is what holds the CCR&R system structure together and unifies us. Regardless of whether we're at the national level, the state level, or the local level, Child Care Resource and Referral as a system has always worked towards these three components to increase the quality, affordability, and accessibility of child care. And Krista, I don't know if I have control to move the slides. Excellent. Child Care Resource and Referral agencies developed back in the 60s when women were joining men in the workforce, and we had two parents in the workforce. There was a great need for families to find child care, And there were these three main components that developed. The first was services for families, really a grassroots movement to respond to families going into the workforce. The primary function was to help those families find childcare. Throughout the years, this has evolved into standardized practice throughout the country. CCR&R's work to help families by offering workshops, by staffing hotlines, by working in local communities, by distributing newsletters. All of this in an effort to serve as a trusted expert on childcare. They also work very hard to help families navigate both licensing, regulations, help families know what to look for when trying to find childcare, know how to pay for childcare. And one critical role that childcare resource and referral agencies play, and many of you out there in the states do as well, and CCR&R, is to help families understand the quality rating and improvement system within that state, and to help parents understand how to use that system to identify high-quality childcare, and essentially how to make the childcare search process easier. At the end of the day, childcare resource and referrals work diligently to help parents make informed childcare choices for their children. They also work, as you know, in supporting families and raising healthy children. That could be through a variety of ways, through connecting them to various support services, obesity prevention programs, etc. The next service component of childcare resource and referral developed a little bit later on in CCR&R's history, and it focused on ensuring that there was enough supply of childcare to serve that demand or to respond to that demand, and to ensure within that supply that there was quality available for families. CCR&Rs in many states and local communities serve as the entry point to the childcare field. CCR&Rs help providers learn about the licensing requirements. They help them become informed about health and safety issues, best practices for business operation, and child development. CCR&Rs also use data to really understand where childcare is needed the most, and then they respond in those areas in a very targeted way. Finally, in terms of quality, childcare resource and referral agencies and state networks are oftentimes the primary source of professional development for childcare providers, staff in those communities. They work to improve the quality of care, in addition through training, by supporting the quality rating improvement systems. That may be through mentors or coaches that work with providers that are either looking to become licensed and meet certain standards, or to move up the levels or the rating system. They often are engaged in quality initiatives that may be funded through a variety of sources. And they also work hard in helping families, providers reach accreditation or other quality benchmarks. Within the community, mentioned that childcare resource and referral agencies, as they build the supply, they do so in a very targeted way. CCR&Rs are the leading source of data on childcare and the environment. They collect data on childcare quality, cost, and availability, and they often are looked to as a primary source to educate decision makers on what the childcare landscape looks like. They also engage partners, and they are often looked to tell the childcare story in the community. So we'll start with just a little snapshot to identify some services that might occur at a local childcare resource and referral. And note that this data is from 2012, so it's a little ways back, and this is an important point I want to raise, is that the childcare resource and referral system has, over the past several years, evolved rapidly. It's evolved in ways to ensure efficiency, to become cost-effective. Child care resource and referral agencies typically are not the highest funded service out there. So they really structure themselves in ways to get the most impact in their community. So in terms of services, in 2012, 93% of child care resource and referral agencies delivered child care provider technical assistance, and that may be coaching or mentoring in a quality rating improvement system. It might mean helping child care providers become licensed or reach accreditation, or implement curriculum to prevent obesity, or even again, accreditation. In terms of training, 95% of child care resource and referral agencies locally offered training. That could be online, face-to-face, in any given arena. 41% of child care resource and referral agencies administered subsidy administration. That's the CCDF funding. It comes from the federal government, and that often allows child care resource and referral agencies to connect and to support families who may be in most need of high quality care, and to make sure that they connect with perhaps the highest rated quality rating improvement system providers or accredited providers. And at the time of this research, 88% of local child care resource and referral agencies delivered child care referrals, and 95% delivered child care consumer education. So information about what high quality child care looks like, what licensing standards are. As time has passed, what we see as a trend is that child care referrals and consumer education are often being expanded in terms of online child care referrals and consumer ed. We're seeing a transition to, rather than local hotlines to find child care, we're seeing a lot of regional or statewide consumer education hotlines. And in many cases, CCR&Rs at the local level are engaging. They're not stopping their services to help families find child care. They're instead leaving their desk, leaving their phone, and getting out in the communities and meeting parents face to face. Just a quick view of child care resource and referral agencies. In 2012, 98% of all U.S. zip codes were served by child care resource and referral agencies. We're pretty confident that this statistic, it still rings true in the states. And you can see in terms of service, 83% of rural communities are served. Our CCR&Rs are active in those areas, 44% in suburban, and 50% in urban areas. I talked a little bit earlier about the structure, and you see that diagram again on the right-hand side, demonstrating both the national, state level, and local structure. There are multiple state network structures, and you'll see them here. We're going to take a tour of those different implementations. We have voluntary state networks, coordinating state networks, managing state networks. We also now have state CCR&R networks that sit within state governments, and we also have a new kind of a newer approach, and this is a single statewide CCR&R agency. That one CCR&R would serve in a way both as the state network and as the entity providing community-based services throughout the state. Voluntary state networks came out of a need from local child care resource and referral agencies to convene and to ensure that there was coordination among their efforts within the state. So generally, voluntary state networks will be made up of local CCR&R program directors, and these directors will volunteer their time to coordinate and to lead the state CCR&R system. Generally, they don't receive any state government funding to support their collaborative work. Due to their funding source, they are typically unable to provide the same level of services that we'll see in the state network models that follow. So I tend to think about the state network categories sort of as an evolution, and the next level in the evolution would be the coordinating state network. However, again, as childcare resource and referral has grown and matured, states have varied in they've kind of moved up the level from voluntary to coordinating, and then they may have gone to managing and gone back to coordinating. But I think just like state governments are really thinking hard about what works best in their state for the delivery of CCDBG and CCDF regulations, CCR&R systems are also in a position to think hard about what's working in their state. So you'll see here, I think some friends on the phone are from New York, Indiana as well. These are situations where there is a paid, typically staff. It could be a small staff or a very large staff. They're responsible for developing and helping to implement childcare resource and referral best practices and standards for the local CCR&Rs. They offer training and support for those R&Rs. They may offer statewide childcare consumer education referrals through a hotline or a website. They typically are in the business of data management and data distribution, so they collect, analyze, and report on data from their local R&Rs and other sources. They work hard to identify where childcare supply and quality are most needed. They either work at the state level to make that happen through direct service, or they engage with their local agencies to put strategies in place. And a lot of times they manage special projects. In Ohio, for example, I know that the Childcare Resource and Referral Network is the operator of the Childcare Professional Development Registry. So the next step, I want to say up, however, also to note that state networks are now, they're evolving in various ways. So managing state networks offer the same types of services as coordinating state networks, and the important point is that they manage and distribute CCR&R funding on behalf of the state child care administrator or the government, the funding that comes through CCDBG. These CCR&Rs determine the range of services for CCR&Rs, and they develop and implement the contracts that fund the CCR&Rs. And they're also responsible for assessing and tracking R&R performance through evaluation, quality assurance activities, monitoring. They often are responsible for reporting back to the state government office about the service levels, areas for improvement, and so forth. We have several models where we have a single, what's called a single statewide CCR&R network. These are sometimes smaller states like Connecticut, New Hampshire, Delaware. These are areas where one single entity, one single child care resource and referral receives funding from state government, and they serve the entire state. They provide services that may be through satellite offices, but generally it's one agency. And then they function like a managing state network in a way, in that they, they're responsible for everything. They report back to their state funder about the service provision. They communicate, and they represent the voice of childcare in a variety of settings, educating decision makers about childcare, facilitating community initiatives and coalitions, but really very different because, again, it's just one single, typically nonprofit organization carrying out the work throughout the state. The final model is what I think could be considered a newer type of model, where state networks actually sit within state government. Florida is a good example of this. I had a call with Florida not too long ago, talked with the state network and the state administrator who were sitting in the same office. And you can imagine the efficiency that comes out of that model, which is really great. They seem to have a good partnership there. Typically in these situations, there is training and technical assistance to local CCR&Rs, but it might be on a more limited basis. Often the benefit of having the state CCR&R network within government is that there's a real strong monitoring of child care resource and referral services tied to CCDF state plans and funding. If we're to think back on the model of the diagram with the Childcare Aware of America at the top, representing national and the state networks and the local agencies, we at Childcare Aware of America have had in place through our bylaws for many, many years opportunities to engage and to ensure that we, as a system, have avenues for communication, networking opportunities, and so we have two opportunities that really engage folks in a very coordinated way. Within state networks, we invite an executive from each state to sit on a state network leadership council. And that council is convened by Childcare Aware of America several times a year. And the role of that leadership council member is to select a representative from their state to serve on what we call a membership council. The membership council represents the perspective of a local CCR&R in each state, and is typically a program director at a local CCR&R. Again, these two councils are a avenue for communication both up to Childcare Aware of America and into the local and state communities. Chatted a little bit about this already, but within each council, 2 members are elected to the Childcare Aware of America board. Each council appoints a representative to sit on different board committees. And again, generally these councils meet monthly via conference call. They convene annually at our National Policy Symposium in Washington, D.C., and our Fall Annual Leadership Council. They promote and share information with others about strategic priorities. They often engage in the public policy agenda and serve as an entryway, again, into states and as collaborative partners.
Great. Thank you so much, Jen. Again, folks, if you have any questions for Jen or for me, please go ahead and type them into the chat box. That concludes the bulk of the conversation today, and I wanted to thank you for being here. In terms of takeaways, I think we've covered a lot of material, and overall, the thing that I most want to get across is how complicated and how really state-specific the child care world is. Unlike a Head Start program, which has federal requirements that each program across the country have to meet, the federal regulations and around childcare are very much give a lot of autonomy to states to have their own influence and say, which means that we within the childcare community have a lot of different avenues to help make improvements or changes to the system, whether it be through the regulatory process to make changes about what licensed providers must do, whether it's through influence of the quality rating and improvement system in getting things like health, nutrition, and obesity prevention measures in a system of quality and really impacting the definition of quality that early childhood programs are measured against, or if it's even making sure that early learning and development guidelines are developmentally appropriate and also easily accessible to child care providers and administrators so that they can properly implement. There's so many different levers in which we can get involved and make positive changes to child care within our respective landscapes. I know that there are so many other factors that we couldn't touch on today, and so another thing is if you'd like to provide feedback on issues that you'd like to hear more of from us, I'd be glad to take those suggestions. And again, I thank you for your time. I haven't seen any, well, I saw one question that came in on CCES funding about how much would a particular state get? How do you use the funds? Are there choices on how to use the funds? I don't have specific answers to that. I am not a finance person, but I plan to follow up with that particular questioner about their state-specific landscape. And if you have additional questions on that, I'd be happy to research that and get back to you as well. Does anyone else have any questions that they'd like to type into the chat box before we conclude today? Jen, any parting notes you'd like to share?
No, thank you again for the opportunity. Childcare resource and referral is ever evolving to meet the needs in the community, and I welcome any questions or calls about specific states.
Fantastic. Well, thanks again, Jen, for your time today. You've been such a leader in the childcare resource and referral world. A workshop on what is meant by quality would be helpful. All right, we will work on that. Thanks so much for that comment, Laurel. And with that, you can see our contact information. I'm krista.scott@usachildcareaware.org. Jen is jen.bump@usa.childcareaware.org. Please reach out to us with any questions you may have or with any ideas you may have on how to move the work forward. Thank you again for your time and patience with us today and for your participation. And we look forward to chatting with you on future webinars and hopefully in person at Symposium. Thanks all. Bye-bye.